Coffee with Coker is a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
All right, well, welcome back, everyone, to another episode of Coffee with Coker. And we'll jump right into today's conversation, which we're talking again with a gentleman who's been on the podcast a number of times, but Jeffery Daigrepont leads Coker's healthcare technology consulting team. And Jeffrey's been a known leader in healthcare technology now for, I guess, Jeffrey, probably going on 20 years, right?
Yeah, 20 with Coker this summer. In fact, I just crossed the threshold.
That's right. Well, you have a lot of relationships in the industry, obviously, a lot of work with hospitals and health systems and medical practices on a wide range of technology needs. But today, what we want to talk about, Jeffrey, is an upcoming book, actually. So it will be available. It's available for pre-order now, but it will be available to purchase the 1st of December. But the book is titled Beyond EHR, Using Technology to Meet Growing Demands and Deliver Better Patient Care, which is obviously something that you and your team have a lot of experience with. So this is published by HIMSS, which again is an organization that you have a lot of background with, Jeffrey, and presenting at the conferences and being a part of different boards and task forces related to HIMSS. So let's dive right in real quick, and if you don't mind, give us an overview of the book and some of the key takeaways that you think will be relevant to our audience.
Yeah, happy to do so, Mark. And, ironically, a little history here. When I joined Coker, there was an unfinished book at the time on technology, and it was for the AMA at the time. And there was just no one available to finish it. And I was very fortunate. One of the very first things that I was asked to do was finish that. And it was actually a second edition book with the AMA. And, keeping with Coker's tradition, we have a pretty robust publishing reputation in the industry on a vast number of topics. And so after writing that book, it had caught the attention of HIMSS. And of course, this was back way before there was any practices really adopting electronic health records, much less even what the acronym stood for. There was no incentive money. And it was one of the very first books to even address the topic. And subsequent to that, I've had the chance to speak on it. And then, of course, later joined a number of the committees that HIMSS had in helping their members and helping Congress and others adopt policies that eventually led to what we know as today as meaningful use and MIPS and MACRA, and a lot of the regulations that tie to the use and adoption of electronic health records. So this most recent book is really predicated on the next, generation of IT adoption. It starts as on the assumption that any reader or audience will have already adopted an EHR, and it addresses some of the limitations that we've encountered as an industry, but also it begins to look beyond. Where do we go? Where should EHR go? And it even touches on very uncomfortable topics such as, artificial intelligence. Should we have listening devices in our exam rooms? Where do we cross the line between allowing computers to guide decisions versus the normal interaction, human interaction that we have? Also, what occurred unexpectedly, literally towards the end of the book, is COVID hit, and COVID completely disrupted healthcare IT in a way that we'll probably never see it go back to the way it was. And all of a sudden, literally within a matter of days, we had to figure out how to convert our entire health system to more of a remote model where we were seeing patients virtually. And a lot of health systems were not prepared for that. There was still lacking in regulations and policies. And so we had the opportunity to really capture that in real time and got the chance to experience disruption in how our market was responding. And so we added a supplemental case study for that. It wasn't part of the original plan, but we had the chance to document that. And then the last thing I'll mention, which I'm very proud of and very honored to have had the opportunity, we enlisted Dr. Jim Morrow to write the foreword in the book, who's probably one of the, consider I don't know what the right term to use for him, but he's the godfather of electronic health records, I guess, or the very well known, one of the early adopters, has demonstrated phenomenal success, Davies Award winner, speaks on it, nationally recognized. And he gave us the opportunity to really analyze their use of technology in terms of best practice, and as an example of someone who's already gone beyond the first generation. So very proud of it. I'm also wants to recognize, while I'm considered the author of the book, we had a number of wonderful contributors, individuals that have been on my team, and quite candidly, were really the brain trust behind the book itself. These are individuals that are at the elbow of the physicians. They work every day out in the field. They see the good, bad, and the ugly. And we had a chance to really capture their experiences and get their input. Chris Torgoza, Gabriel Harry, Connor, maybe missing a few. I think Denise contributes. So it was really a team effort. And of course, we had a phenomenal editor, Kay Stanley, who contributed. And then, of course, HIMSS had their editors that also made a lot of stylistic contributions and really helped us, make sure we crafted it in the right audience and in the right format. So yeah, it was a big effort, but we're definitely proud of it. And I want to thank everybody who worked on that project.
Yeah, no, I think that's well said. I think we are very proud of it. And this is going to be something that is going to be very meaningful for everyone. Again, like you said, we're not talking about EHR adoption anymore. We haven't for years. It is certainly beyond that. And we're talking about a number of different things. And I like what you said about the team contribution, because the knowledge and insight related in this book directly comes from that, like you said, seeing the good, bad, and ugly, but our team being on the ground with clients, addressing all of these things, like you said, artificial intelligence. I know there's also a lot, it goes into a lot of depth on analytics and deep learning and kind of the data and analytics behind the information systems that are being ran throughout the healthcare system. Migration to a new EHR or interoperability between the EHR and other systems, that's something that never goes away, regardless of what system you're on, with what vendor you're with, any of that. That's always going to be a kind of front and center thing to think about, overcome challenges there. So and then, like you said, the way in 2020 that our entire healthcare system was just completely thrust into being forced to embrace a remote work environment, brought in things like cloud computing, more electronic patient to consumer direct engagement. And then the never ending, sometimes challenge, but certainly requirement of cybersecurity. And with telemedicine and telehealth definitely becoming a part of mainstream healthcare delivery, cybersecurity has been forced to evolve a lot over the last few months. Would you agree?
Oh, of course, yeah. And not that there were, many great things that could come out of COVID, but I do think it forced us to take that hard, long overdue look at how we were functioning from an IT perspective. And sometimes it takes a crisis to really get the needed change and be the spark that creates some of the innovation that had been lacking. Another area that we didn't mention, but it is addressed, and you touched on it, is the analytics. The other thing that COVID obviously brought to light was that we're probably not doing the best job that we are in really truly coordinating data, the surveillance. I mean, one of the things that we discovered in our research that was quite telling is that Google now can detect where the flu outbreak is going to occur long before the CDC can. And the reason why Google is better at detecting it is because they're aggregating the search type of activities that's occurring. So they're now feeding that data back to the CDC to say, hey, something is occurring in this particular area and that we should have early intervention. And, part of the things that the challenge in dealing with a pandemic is, how do you do contact tracing? How do you have any sort of intervention? How do you, manage what treatments are working, what's not working? All those data points that are so critical to making really quick decisions that can save lives. We found that to be extremely challenging, and candidly, not to, make this political. We still don't really know what is the most effective way of addressing it. Certainly, I think you want to consider all things that make sense, but data is now starting to show that sometimes how you respond can actually have consequences too. In fact, some consequences can be even more deadly than the virus itself. So again, not to harp on that, but I do think we were fortunate that it occurred before the book was finalized, because it did give us that opportunity to go back and take that really hard look. I mean, there's one thing to have hypotheticals, here's where we're going, and then there's a dramatic seismic shift in what you have to do in response to a crisis that then calls into focus what our weaknesses are and where our opportunities to innovate. And I'm very proud of our country. I mean, despite some of the challenges, I saw this morning that despite cases going up, deaths are way down. That tells me that our health system, despite its flaws, is improving. And we still, in my opinion, have some of the best healthcare in the world. So very proud of our innovators and our industry. And, think about it, it hasn't been that long ago. And I think for the most part, at least we're seeing from our clients, they're back to normal as far as volume goes. They're just doing it a little bit differently.
And I think it's safe to say that would not be possible without the utilization and advancements of a lot of these technologies. I mean, just being able to do some of these things completely changes the game for how healthcare is delivered. And then, like you said, even managing care when it comes to analytics and reporting and things like that stuff is critical in order for us to be able to continue on, particularly in times like we've been dealing with in 2020. One of the things, and I did want to go back and mention, I'm glad you mentioned the foreword by Dr. Morrow. We've known, like you said, we know Jim Morrow for, 12, 13 years or more probably. And his group, Morrow Family Medicine, is, like you said, it has been the case study in how a practice can successfully adopt, implement, manage, and continue to innovate as it relates to technology. And so I think he deserves a tremendous amount of credit for that, and we're honored to have him contribute to the book as well.
One of the things that's kind of fun to watch is I'm pretty active in social media, and I actually live up in Fort Georgia, where Dr. Morrow has a practice in Cumming, Georgia, and one in Fulton. Alpharetta. And anyway, anytime someone asks, well, who's a good primary care, it is him overwhelmingly getting recommended. So I think his catchphrase is, a high-tech hometown physician, or, he's very traditional, but in a extremely high-tech way. And if you ever get the privilege of visiting his practice or engaging with him, he's done some amazing things. In fact, his practice is almost touchless. They figure out a way to get patients in and out, keeping their staff safe, keeping their volume up, and also meeting the needs of the community. And they're doing it as a private practice. I should have mentioned that. This is not some VC-backed, funded or, hospital supported. This is a private practice that's having this level of success. So it just goes to show, if anyone's intimidated, or you're just starting out in your career, or maybe you're considering going in private practice, there are many trailblazers out there. Dr. John Lynn is another example of one of our clients that has done phenomenal things with his technology. And so great leaders out there. And I would encourage you, if you haven't done so already, take a look at some of the things that Dr. Morrow has done, and as a good mentor and a good example of what's possible.
Absolutely. Yeah. No, I think that's a excellent recommendation. One of the things I wanted to kind of bring full circle, but I believe one of the last chapters of the book, you have a vendor presentation scorecard. Just describe what that is and why that's relevant in this context.
Yeah. So I think we said that the book was predicated on next generation and beyond EHR, and it assumes that everyone has an EHR. But one of the problems that we're running into and we're seeing is that in the early days of EHR adoption, there were 600 plus vendors that was in the market. And today, many practices, unfortunately, are still operating on systems that have since been commercially discontinued. I don't consider those new EHR adopting practices, but they will certainly have to go through a system migration or a change. And in that case, we felt it was necessary to give them more updated and modern resources. For example, many of the early checklists that you would use to make a vendor of choice decision did not include telemedicine. It did not include remote care monitoring. It did not include a lot of the cybersecurity concerns. In fact, there wasn't even, it's a macro back then. There wasn't the requirement to do a security risk assessment. Cloud computing hadn't yet come out. Everything was on premise. Everything was interfaced. And so what we discovered was that even though this was kind of built off the first edition that had a lot of those good things. And by the way, the first edition, if there are folks that are, which it happens on occasion, that still hasn't adopted, or maybe you're just starting out in your career, if you go get the first edition, that book is really geared towards anyone who wants to select technology. In this one, we felt that it was necessary to provide some tools, but those tools are mostly predicated in buying your second, third, fourth EHR, migrating to a net new EHR, converting from an on-premise to cloud, moving your data from one system to the next. And what I will tell you that we've also learned, and we tried to highlight this, is things like data blocking and how do you get your data back and in what format and what things you should have in your contracts. If you're already a well-adopted practice with full automation and you're happy with your vendor, now would be a really good time to go look back in your contract and see if you have terms that require them to give you back your data when you terminate. Don't wait until you're trying to leave to ask for that back. You may find that it's going to cost you a lot of money, whereas today you may just get it as part of your contract. So we tried to think of it not in the context of a brand new, never had EHR. This is more geared towards those folks that are going beyond what they have, or maybe they're going to the next generation of EHRs that's on the market.
Yeah. I just want to mention that because, I think it's a extremely helpful, tool for all of our clients. Like you said, regardless of where they are from an adoption or transition or migration standpoint, this is something that remains relevant. And I think, continuing to follow that scorecard or, track the results over time makes sense. So, and I think there are a number, that's just one example, a number of those things that Coker has and works with our clients on regularly. So like I said, I just want to mention that.
The one thing about writing a book on technology is that when you go back and look at your previous work, there's a lot of cringeworthy comments and assumptions. I'd say for the most part, we got most of our predictions right, but there are a few things that, like I said, it changes, right? And even this book at some point, probably, it doesn't have quite the shelf life you would hope that it has. I mean, I think there's fundamental things that's going to apply no matter what. But
sure,
IT, in particular, especially healthcare IT, we are seeing, I forgot the rate of adoption. I think it's actually documented of how fast the advances, the processing, it's phenomenal, the amount of improvements that it makes in such a short period of time. And of course, there's other things that, are on the horizon that's probably going to have other additional disruptions that we'll have to confront as an industry. There's a lot of uncomfortableness around this artificial intelligence stuff. We tried to touch on it. There's not a lot of good case studies right now, but there are many people who are questioning the ethics of it, the integrity of it. Where do you draw the line between what is, should be a human interaction? I mean, we are talking about healthcare at the end of the day, and these things are very, very personal, and, there has to be boundaries. And so we tried to address the ethical side of artificial intelligence as well.
Yeah. Which again, I like you said, that's going to be an ongoing, evolving conversation. And, a few years from now, it may look very different. But I agree with your general premise that it is continuing to change. And 2020 has only shown us that there's a lot that can change very quick. And so, I think that's a good thing for healthcare, though, because as crazy as it sometimes feels like the role of technology in our lives and everything that we do, it is something that is, brings a tremendous amount of value and quality. So I think that's always welcomed in our industry specifically. So, listen, I think, we covered a good portion. We'll make sure that there's a link to the page where you can order the book. You can pre-order again, as I said earlier today. It'll be available to the public the 1st of December of 2020. So we'll make sure that's available. And then obviously, if folks have questions for us as far as any further topics that we touched on in the book, or maybe that we didn't touch on that would like kind of more information on, we'd love to share that with our listeners and our audience. So we're looking forward to this coming out, and we're looking forward to continuing the discussion and the work that we're doing around healthcare technology. So I appreciate it, Jeffrey, for giving us a little bit of rundown on what this book is going to be about, and look forward to see where it goes from there.
Yeah, no, absolutely. And one last thing I'll say is if you do get the book and you find that you want access to some of those tools, just email us and we can likely email you the Word version or the Excel version of the tool itself. So that way you can have something that you can edit and you don't have to recreate it. So happy to do that if you find anything in there that you want to use for your practice. So take care, everyone, and enjoy the opportunity, Mark, to visit with you.
Yeah, thanks, Jeffrey. Looking forward to seeing this come out in December.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback. And we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.